Hello, my name is Celia Smith, and I'm currently an LPN. I attend Indiana State University's LPN to BSN program. Today we're going to discuss alcohol and substance abuse in America. First, we're going to take a little pretest. You can find this link in the bio or information of the video, or you can click what you see here. I'll give you a minute or so to go ahead and get the pretest out of the way, and then we will continue on. Objectives of this presentation will be to identify substances and their effects, recognize substance abuse signs and symptoms, and identify treatment resources available to you. We're going to start with what is substance abuse. Substance abuse can be the overindulgence or the dependence of an addictive substance. The substance can be a prescription, a non-prescription medication, an illegal drug, or it can simply be returning to use after remission. Anyone who uses opioids or illegal drugs have the potential to become addicted, as it causes a chemical reaction and changes in the brain. These substances can be used intravenously, orally, or topically. There's several factors that can increase the risk of substance abuse or misuse. Developmental factors, environmental factors, social factors, genetic factors, and mental health disorders. Every person has unique combinations of risk and protective factors that will affect the probability that the person will use or misuse substances. Early childhood experiences can increase the risk of developing a substance abuse disorder. A range of experiences that include physical, emotional, and sexual abuse, neglect, household instability such as parental substance use, mental health disorders or incarceration, poverty, and initiation of substance use in adolescence also leads to an increased risk of later development of a substance use disorder. A person's environment includes many different influences, from family and friends to economic status and general quality of life. Factors such as peer pressure and physical and sexual abuse, early exposure to drugs, stress, parental guidance can also greatly affect a person's likelihood of drug use or addiction. Substance use and mental health disorders often co-occur in individuals. There's a high prevalence of alcohol use disorders among people with a diagnosis of PTSD. There are several theories about why substance use and mental health disorders co-occur. People with mental health disorders may use different substances to help cope with symptoms of their disorder. Substance use disorder may also lead to mental disorders by changing the way the brain functions. People who are at higher risk of developing a substance use disorder may also be at an increased risk for developing mental disorders based on genetic factors or life experiences, and vice versa. Drug classifications. There's three main drug classifications: stimulants, central nervous depressants, and hallucinogens. Stimulants increase alertness, energy, increase blood pressure and heart rate, as well as breathing rate. A few examples of these are dextroamphetamine, methylphenidate, cocaine, and methamphetamines. Central nervous depressants slow down brain activity, which also make them useful for treating sleep and anxiety disorders. Xanax, barbiturates, heroin, opioids, and alcohol are a few common examples of central nervous depressants. Hallucinogens tend to distort the perception of one's reality. A few of these medications could be ketamine, LSD, PCB, psilocybin, DMT, and marijuana. What is excessive alcohol use? Excessive alcohol use is when a person consumes too much alcohol. This can be harmful and detrimental to your health. Excessive alcohol use can be classified in two categories: binge drinking and heavy drinking. Binge drinking is classified as 5 or more drinks on an occasion in a 2 to 3 hour window for a man, and 4 or more drinks within a 2 to 3 hour for a woman. Binge drinking is 15 or more drinks in 1 week for a man and 8 or more drinks in 1 week for a woman. Binge drinking is also classified as any pregnant person drinking or a person who's younger than 21 years old. Excessive alcohol use causes over 95,000 deaths per year in the United States alone. Signs of substance abuse. This is not an all-inclusive list. There's quite a few more. These are some common physical and behavioral signs. Physical signs would be inability to sleep, being awake at unusual times, and unusual laziness. Loss or increased appetite, changes in eating habits. Cold, sweaty palms or shaking hands. Red, watery eyes, pupils larger or smaller than they usually are. Unusual smell on breath, body, or clothes. Extreme hyperactivity and excessive talkativeness. Slowed or staggering walking. Poor coordination. Needle marks on lower arms, legs, or bottom of feet. Irregular heartbeat. Runny nose, hacking cough. Frequent rubbing of the nose. Frequent twisting of the jaw back and forth, and overall deterioration of hygiene and physical health. Some behavioral changes are changes in overall attitude or personality with no other causes, changes in normal activities or hobbies, moodiness, irritability, nervousness, chronic dishonesty, paranoia, general lack of motivation and energy and self-esteem, kind of like an I don't care attitude. Changes in personal grooming habits, possession of drug paraphernalia, possession of a false ID card, people around the person potentially missing prescription pills, complaints of a sore jaw from grinding teeth. Some statistics in the United States is that 19.4 or 53 million roughly individuals 12 and over have admitted to using drugs or misusing drugs. 139.8 million Americans 12 years old or older drink alcohol. 10.6 of those individuals have an alcohol use disorder. 31.9 million people in the United States use illegal drugs. 25.4 of those who use illegal drugs have a drug abuse disorder. And 2 million of those who have a drug abuse disorder have an opioid abuse disorder. There's different types of treatment options available to somebody who needs help. Intensive inpatient treatment, individual psychotherapy, group therapy, education and counseling support. There's a few different places to find help. One of them is SA's National Helpline. You can contact your local community health agency for resources near you. Contact your primary care provider or social worker for assistance. And sometimes the best way is to reach out to a family member, letting them know you're in crisis and need help. We will do a little Pretest now. The survey link is also in the information or bio of the video, or you can simply click here. Here's some further references if you would like to do some more research. Thank you for your time today. This concludes our presentation on alcohol and substance use.